know that knowing how to take a pulse can be a life-saving skill? I have taken many health and anatomy classes while I've been in high school, and I have learned a lot about our bodies. I have also done multiple projects in these classes about blood pressure and your pulse. It is important to know how to take a pulse to help people in extreme situations, or just to become more informed about your own health. In this speech, I will show you how to take a pulse on the wrist, on the neck, and some facts to know about your pulse and how it can affect your health. The first way to take a pulse is on your wrist. First, you will take the arm and have it palm side up. Secondly, take 2 or 3 fingers, I prefer 2, and place them on the top of the arm, a little above the wrist. Also put your thumb on the underside of the arm parallel to the fingers on top. Next, press firmly on the arm and move around until you feel a pulse, which will feel like a beating sensation. Don't be afraid to move around your hand a little bit, it's kind of hard to find. After that, find something to tell time off of, like a phone or a stopwatch, and set a timer for 15 seconds. It's easiest if you're able to have somebody else start the timer. Once the timer is started, count the number of pulses you feel until the timer goes off. Then, finally, multiply whatever number you get by 4. For example, when I did this before, I counted 16. So I will multiply that by 4 and my heart rate is 64. Now that I've told you about taking a pulse on a wrist, let us discuss taking a pulse on a neck. For taking a pulse on a neck, I will be using one of my audience members. So, can you please come up? Okay, so first you will place your index finger and middle finger on the neck. It should be in between the jaw and the windpipe. Next, much like taking a pulse on the wrist, press firmly against the neck and move around until you find the pulse. I find this one easier to do than on the wrist. Once again, have a timer and count the number of pulses you feel until the timer goes off. Then multiply the number of pulses counted by 4, and that is your heart rate. Thank you. Now that I've told you about how to take a pulse on the wrist and neck, I'll discuss benefits of knowing how to take a pulse and important things to know. There is hardly a reason to know how to take a pulse if you don't know why it's important, so here are a few things to know. A normal heart rate, when active, is 60 to 100 beats per minute. However, athletes or people who are more fit might have resting heart rates of less than 60 beats per minute. Tachycardia is when your heart rate beats faster than most people, and this is normally when it is 100 beats per minute or more. On the other hand, bradycardia is when your heart beats slower than most people, and this is normally when it's 60 beats per minute or less. Being able to track your pulse can help you have or believe you have one of these problems. Some other benefits of keeping track of your heart rate is that it can give you an understanding of your fitness level, your heart health, and your emotional health. In conclusion, today we have learned how to take a pulse on the wrist, on the neck, and we've also learned some important facts about our pulse and why it is important to know how to take it. Now that you've learned how to take a pulse, I urge you to try it on your friends or on yourself and see how easy it is. Remember, your pulse is a window into your well-being, so take a moment to check in. Thank you for listening and make sure to stay mindful of your heart health.